SchieX is a way of exchanging health information to the benefit of patients and for doctors who are caring for patients. So one thing that providers have done in recent years is to adopt an electronic health record. SchieX is really an information highway. So the provider keeps the data, but when another provider has a need to know, it provides the highway that allows that information to go to that provider so that they can provide the best care.
SchieX is utilized frequently in the emergency department because you may have a patient come in that blood sugar's low, they can't talk to you or communicate with you.
If you had an accident in Greenville and you had been a patient here 2 weeks prior, they would be able to pull up the medical summary and see what you were here for.
There are medications we can't give you if you take certain medications. If you're not able to communicate that with us, SchieX really helps us be able to determine the best plan of care.
As we talk about exchanging information among providers in South Carolina, we need to make sure we understand the value of that information and how it really can halter or stop your care because the information is not at the doctor's fingertip.
The information we need follows us where we go so that when we need it, we can access it. SchieX also provides additional security for the routing of that information. We always have a choice. The patient always has a choice to whether to be a part of SchieX or not.
Most of our patients say, yeah, I would like my information out there if I had an accident in Greenville or down in Charleston.
One thing that Health Information Exchange can do is to help solve the problem of duplication of tests. If I've had a test done last week that a physician needs to know today, then they would have access to that rather than me having to go home and wait for that test to be run and come back 3 or 4 days later. What if it's an MRI and that duplicate test ends up costing me $600–700? I end up better because I don't have to keep paying.
The benefits will just grow as more and more hospitals and physician offices sign on and connect with SchieX.
That's really the future. Any record, anywhere, anytime, so that doctors can take care of me in an informed way without having to guess.